In summary, based on the financial and operational analysis and the research conducted on TMF's 2012 and 13 financial reports, the following strengths, weaknesses, opportunities, and threats have been concluded. In reference to its strengths, TMF holds over $752 million in annual revenue. It's also an emerging leader in the healthcare delivery market. So in reference to its servicing rural and smaller communities, this strategy has strengthened the organization's name recognition and financial position, which has resulted in a pending merger with CHRISTUS Health, which produces more than $2 billion in annual revenue. TMF is also ranked number 1 in Texas for patient safety in overall hospital and surgical care in 2016. Trinity Clinics is the area's preferred multi-specialty medical group with more than 330 physicians and advanced practice providers representing 40 specialties and 36 clinic locations serving East Texas. That's pretty big. Now, TMF also offers a complete range of services which include advanced technology and innovative procedures, as well as skilled and experienced staff to ensure the quality healthcare you need is available. It's really important. Its nationally recognized cardiology program, advanced surgical capabilities, and innovative neurological services is definitely a strength. It's equipped with a skilled workforce which drives its ability to provide quality care. Its commitment to excellent care is demonstrated through the implementation of new nursing policies directed towards improving patient safety. Now, TMF's facilities located in smaller communities allow the organization to serve where patients have limited options to quality healthcare services. This creates a higher demand for healthcare systems located in such rural areas. From a financial perspective, with 51% of payments for third-party payers and 7% self-pay, TMF's reimbursement remains strong in the midst of a changing health care landscape. Now, as we discuss its weaknesses, we want to keep in mind that it does face serious capacity issues, or at least it has in the past. Trinity Mother Frances faced the dilemma of not having enough space for all patients who needed care and not being able to discharge patients because they still needed more care. So the solution was to incorporate a long-term acute care hospital on their current campus. This fix, it did work for a while, but then began to cause problems when CMS began utilizing length of stay for Medicare reimbursement. So this issue's created a weakness for TMF that must constantly be monitored or risk being in non-compliance with TMS and not receiving adequate reimbursement. TMF has also been able to maintain this long-term acute care facility by implementing a mission criteria and focusing on physician satisfaction. Therefore, TMF has been able to overcome its one-time weakness. Now, in reference to its opportunities, the potential merger with CHRISTUS Health and as the world becomes more wired, telehealth will allow TMF a broader reach. So with the creation of clinics and the use of electronic devices, healthcare is being delivered in communities that didn't have adequate access to healthcare in the not-so-distant past. Now, with the aging population, the long-term healthcare market is growing exponentially for this segment of the community. So this positions TMF as a leader in the East Texas market by addressing this issue and proactively seeking solutions for the citizens within the Smith County region. Now, with strong financial footing, TMF will be able to provide the healthcare in the region through preventative healthcare outreaches and partnerships with churches, schools, and civic organizations. The organization can also train healthcare champions and utilize them as resources to provide health education awareness throughout the community. So those are some of the opportunities that are before TMF. Now, it's threats. So we know that threats negatively affect the performance of a facility, and in that other healthcare facilities with greater financial strength entering the rural and international markets is definitely a threat for TMF. However, its partnership with CHRISTUS Health serves to outweigh that issue. Now, with that being said, we also have to consider that because of the merger, it's going to cause an increased demand for updated technology measures that will be very costly. Because of the merger, we're also going to attract other competitors that TMF didn't really have, on their radar prior to. The other thing that we want to consider is the facility financially ready for such expenses? Because, of course, this can put us in a position of unstable economic and political positions. And again, like I said, becoming a part of the CRISIS network, the merge is going to bring increased competition within the network from many angles. There could possibly be some reimbursement and regulation changes as well, which can cause an economic shift and a higher market demand. Now, in reference to our recommendations for TMF, we state that the company should focus on continuing its expansion. So we think that the merger with CRISIS is definitely an important strategic plan, and that it's an effective one. We also encourage the company to embrace technology, to focus on financial growth, and to remain rooted. Continue to do what you've been doing for the last 75 years and just build upon that. So again, our recommendations is to continue to expand. We see the merger with CRISIS as a great opportunity and a great decision. Embrace technology, continue to advance and invest in that, and then focus on the financial growth and remain rooted. Again, are our recommendations. Here are our references, and if you have any questions, please let us know. Thank you for your time.